I'm Ashley Perry. I'm the Intervention Case Manager at Project Weber Renew. We are a peer-based harm reduction organization where we offer peer support and harm reduction services for high-risk people. We would meet up with our team, we would get together a bag full of Narcan, a bag of water, a bag of snacks, a bag of fentanyl test strip, a backpack full of condoms, safe injection kits, put it all in the van. Well, we're gonna see who's out there, see if it's some of our regular clients, and see what we can give out.
My daughter tells me, Mommy, do you really want to keep on doing this? You got 2 grandkids, you know, and I want to see you get better now.
Okay, what about the ID?
The ID, I have to go to a register.
Because we'll provide you a voucher for that. Yeah, we do ID vouchers.
Primarily our clients are homeless, so a lot of them actually do depend on us. We have people that tell us all the time, like, we're so happy to see you guys, you know, that even if they just needed like some water, you know what I mean? What's the matter? You look down.
Do you need anything?
Yes.
Water, snacks,
what do you need?
Condoms? What do you do?
And can I get some needles for my cousin?
Sure, we give you some needles.
Yeah, it helps to keep me like centered and focused on, you know, like not really forgetting like where I could be, because I know like any moment I could lose everything and, you know, go right back to being a sex worker, you know. And a lot of times that comes along with doing drugs, you know what I mean? So it really keeps me like focused on what I should be doing.
So REST, which stands for Resources, Education, and Support Together, is a non-traditional, peer-led mutual aid group for families with a loved one with substance use disorder. Today, I was invited by the First Congregational Church in Bristol, Rhode Island, to come out and do a REST presentation with a Narcan training, and we had some really good attendance at that presentation. The U.S. Surgeon General came out last year and said that every U.S. citizen should have Narcan on them at all times. So that's my goal. I'm supporting the distribution of Narcan widely in the state of Rhode Island.
The fire service is all about preventing tragedy and helping people, you know, in their time of need. And with the Safe Station program, it's just another way for us to do that, to help the people in their time of need.
When we first got the opportunity to apply for Code 1, Little Compton, Tiverton, and Portsmouth opted to work together to develop a plan that covered all 3 communities. Last year for Code 1, we had a focus on faith and fire, creating an opportunity for those faith leaders to get on board with the work that we were doing, and most importantly, providing them with resources that might be helpful in the work that they do. The fire side of our Code 1 plan was to look at Providence Safe Stations as a model and think about how can we replicate that in a rural and suburban community where we don't have 24/7 supports for mental health. So for Code 2, what we chose to really focus on the fire piece of what we were doing. We're also offering our fire personnel the opportunity to participate in mental health first aid. Tiverton, Portsmouth, and Little Compton have already sent some of their fire personnel to that training. We are linking up with an instructor from Bradley Hospital and specifically providing training that's meant for first responders.
So up here in the northwest part of the state, we're not fortunate enough to have public transportation. We also have a lot of low-income people up here that may not have the means to be able to even have a car, never mind the gas to put in it. So I kind of had this brainstorm that why couldn't we take coaches and why couldn't we train them to be peer recovery specialists and to also be trained in first aid and CPR and give them the ability to transport or partner with someone who would transport coaches to Woonsocket, to Providence, to the Pain Solution Center at Kodak.
So knowing that somebody else has reached a point in recovery and knowing that you're not going to be judged, I think it creates a more safe place to be within yourself and within the surroundings of the people that you're with.
So the HOPE Initiative, a great new initiative in the state of Rhode Island. It's the first statewide outreach initiative in the country. And really it combines law enforcement with our substance use professionals for the purposes of really engaging population and at-risk individuals who are prone to either be involved in an overdose incident or activity that is at risk.
As a police officer, you're worried you're going to give something that you haven't experienced yourself, and it's not the contact that they need, and now they've lost faith in the police department. So to have this training today, there was buy-in that this actually is a reliable source. We're meeting the clinician face to face, and there's some confidence in what we're going to be promoting when we go out and do these visits.
We would team a Richmond officer who's been trained in outreach techniques by the Hope Initiative and team them up with one of our substance use professionals that are in our program.
It gets a hold of you. I thought I was the tough as nails as you could get. Sunshine, I'm telling you, I never thought anything could bring me down.
In order for you to be able to continue to be that person that helped, you gotta help you first.
I understand.
Okay?
What we want to do is really, after identifying, take action on that and have that conversation with the individual and try to encourage them of the different treatment options that are available out there for them. If we can pay a little more attention to the demand and the people that are battling with substance use disorder and try to encourage them to be assessed and treated, then we can dramatically reduce our overdose fatality rates. That'll help them and try to encourage them to get back on the right track.